Oh no, your child has just broken a bone. What to do next? Don't panic, we've got you covered. Join us for a step-by-step guide on how to handle a broken bone and ensure the best outcome for your child. Broken bones and sprains account for 12% of the 10 million visits per year to the United States pediatric emergency departments. Broken bones in children exhibit unique patterns. Because of the distinctive properties of the growing bones, special attention is required to guarantee adequate healing while avoiding growth disturbance. In this video, we'll review how to recognize if a bone is broken, first aid for kids, what to expect at the hospital or doctor's office, treatment options, and recovery care. I'm Meg Conover, physician associate, and I'm here to help you better understand what to do when your child breaks a bone. Today we'll be addressing broken bones in the arms and legs. Signs of a broken bone include a specific mechanism of injury, like a fall or crush injury, any sounds that may be heard during that injury, immediate pain, swelling, bruising, deformity, and possibly open wounds. Also lack of function, inability to walk, grab, or hold as normal. For an arm injury, you can test this by attempting to hand a small child a toy, observing if and how they reach and grab for it. Also consider bone injury if your child is continuing to complain about a specific body part over several days. Any of these findings mean you should immediately head to your doctor, ER, or urgent care. Once you recognize that it's possible something may be broken, it's important to protect the injured area. This means keeping the joint above and below the injury site from moving. For example, if you're concerned about an elbow fracture, which is very common in children, it's best to fashion a sling that will keep the shoulder, elbow, and wrist from moving. Usually at home or on the scene, there aren't typical casts or splints. It's reasonable to use everyday home objects, t-shirts, clothespins, pillows, sticks, cardboard, scarves, and anything you might have on hand. If there are any open wounds, it's best to keep them clean and covered. You can wash with soapy water or HIPAA-cleanse if tolerated, or just cover as you head to the doctor's. Once you arrive at the emergency room, urgent care, or doctor's office, you can expect to have a complete evaluation by a provider. Imaging will likely include x-rays at a minimum and sometimes even CAT scans. Typically, sedation is not needed for small kids. After reviewing x-ray findings, your medical provider will recommend a treatment plan. These can include a range of options such as bracing, splinting, casting, therapy, and possibly surgery. Broken bones that are well aligned despite being broken usually heal very quickly in children. The vast majority of broken bones in children do not require surgery. Surgery is recommended when adequate healing is unlikely based on bone position and the location of the break. If braces, casts, or splints are recommended, rest assured there are many novel options for children. Plaster, orthoglass, molded, Velcro, and even active armor waterproof casts are options available based on your doctor's recommendations. If open or dirty wounds are located near a fracture site, your provider may prescribe antibiotics to prevent infection, as well as prescribe an updated tetanus vaccine. Fracture healing can take anywhere from 4 to 16 weeks, depending upon the type of break and the recommended treatment, surgical or not. Expect your doctor to monitor healing with repeat x-rays to evaluate fracture healing and growth plate recovery, usually every 2 to 4 weeks. Once adequate healing has occurred, splints and casts will be removed and movement can resume. Sometimes physical therapy can help regain full movement. If therapy is recommended, it may be prescribed for 2 to 3 times a week, at least for 4 weeks to start. Children usually have fantastic recoveries following broken bones, as long as they are addressed urgently by a doctor or a PA and the treatment regimen is followed. Any delay in treatment or care can cause worsened outcomes and possibly lifelong loss of function and pain. To prevent broken bones and encourage strong bone growth, make sure children get adequate dietary calcium, either in the form of cow's milk or other fortified foods. Also remember daily exposure to sunlight for adequate vitamin D. Remember, breast milk is low in vitamin D, and breastfed infants should be supplemented with vitamin D drops daily. Vegetarian diets in children put them at risk of vitamin D and calcium deficiency, which can lead to rickets and osteomalacia. Rickets is a disease with deficient bone mineralization at the growth plate. So here are the key points. Recognize when your child might have a broken bone. When you suspect a break, immobilize the injured area and the joint above and below. Go to the doctor, emergency room, or urgent care as soon as a break is suspected. Expect to have an exam, x-rays, casting or splinting, and possible surgical recommendations. There are many unique casting and splinting options for kids. Check out active armor, waterproof casts. These are the best I've seen for kids. Know that bone healing can take 4 to 16 weeks depending on the type of fracture. Remember, children heal bones very well as long as they're addressed and treated urgently and appropriately by medical professionals. I hope that was informative. I hope you feel more assured in case your child has the signs of a broken bone. You'll know what to do next time time and where to go. I'm Meg Conover, Physician Associate. See you next time.